this practice that is all about addressing low back pain. Now, there are a myriad of factors that can contribute to low back pain. It's not just mechanical, it's not just bulging discs, for instance, or posture or the way you're moving. It can be everything down to your diet, your sleeping patterns, your stress levels. Everything is really contributing to what is happening in the low back. In this practice, we're going to be looking at, in particular, the breath and the three-dimensional breathing pattern. We'll look at releasing some of the deep held tension that's held within the gamma motor neurons within the muscle spindles. And then we'll also look at a little bit of stability work, utilizing the breath and really trying to switch on the deep core and pelvic stabilizers. So grab yourself a block, grab yourself a squishy ball. If you don't have a squishy ball, you could just roll up some socks so that it's a little bit squishier. You could use a hard ball if you like, but I like to use something a little softer. And then something that you can wrap around your ribs. And we'll start off in a comfortable seated position. And you'll take the band and just wrap it around the rib cage so that all the sides of the ribs are in contact with the band. You don't have to tie a knot, just a loose cross in front will do. Relax your shoulders. You can either close your eyes or soften your gaze towards the ground. And begin by first bringing awareness into the back body where you feel the strap is resting. And see if you can start to expand into that place. And starting to facilitate a 360-degree breath. For many of us, when we are under stress, we tend to resort to upper chest breathing. And we're no longer able to get this full excursion of the diaphragm, the full circumference of the rib cage expanding. And it's this full circumference of the rib cage expanding that really helps us to create the intra-abdominal pressure for stabilization. And see if you can make your exhalation slightly longer than your inhale. Which will help us to just switch gears into the parasympathetic nervous system. And sometimes that's all that's needed, is to actually switch down a gear. As we spend much of our day, much of our week, much of our year in that sympathetic nervous system activation, which can also increase the level of tension within the muscle, which can also lead to a source of discomfort or pain. Last few breaths. And see if you can keep that three-dimensional expansion going as you let the strap fall down. And then make your way down onto your back. Have your block handy. We'll start out just with the legs out long or knees bent if that is uncomfortable. And just take a check in, particularly through the lower back. Notice the distance between your lower back and the floor. And notice any tension that you might feel around that area. And see if you can still expand into the back body, the side ribs. And then bend your knees and place your feet on the floor. Take your ball and you've got your spine in the center. You're going to go just on one side from pretty much the top of your pelvis up to the bottom of your ribs. And you'll be rolling the ball like this, just nice and slowly all along that tissue. So I'm going to start with my left-hand side right down near the pelvis, and then I'm just going to gently rock from side to side, massaging all of those muscles and tissue around the left side of the body. So getting into basically the erectors and the QL or quadratus lumborum muscle. Oftentimes when we are under a lot of stress and really kind of go, these muscles, the muscle spindles within them can get set slightly more in that kind of tighter place. We don't have the full length of the muscle spindle available to us. And the other thing that this is providing is proprioception. And proprioception is basically that ability to kind of map our body, know where our body is in space. And that helps to quieten down the nociceptive, or the danger signals, if you like, that go up to the brain, and then the brain decides whether to send out a message of pain. So the greater map we have of the body, then usually the less pain, or the pain isn't felt quite to the same level. Good. Keep working slowly up and bringing all of your mindful awareness to where the ball is rolling. And just noticing if there's areas that are a little tighter. If there are, you might just stay for a little longer and really focus on exhaling and slowing that exhalation breath out. And I've got a nice one just on the side of the QL, so as you rock out to the side, you may even have to just slightly turn the body. And really try to make your exhalation 2 counts longer than your inhale if you can. And take the ball out, just rest on the mat for a moment and notice the difference between the side that you've done and the side that you're yet to do. Maybe that side's sitting a little closer to the floor, maybe it feels a little softer, or maybe you just are more aware of it. And once you've made that observation, take the ball underneath the right hand side and do the same. So you're going just from just right of the spine all the way out to the side and back again, and slowly making your way up towards the bottom of the ribs. And if you find any tender spots that you want to pause on a little longer, just stay there and really sink into a deeper exhalation. Let the body melt and yield into the ball. The ball also helping to just change the structure of the fascia through this lower back as we provide a little bit of pressure. That's why I like a ball that is slightly softer, because it enables the fascia actually to become a little bit more liquid-like, rather than for it to want to kind of force us out. So it's almost like that little bit of pressure enables the fascia to melt a little. Good, and then just put the ball to one side, and again take a little check-in and notice how the lower back is feeling. We'll do a very gentle pelvic tilt exercise that'll bring you into flexion and extension of the lumbar spine. But really try to keep this within a range that is gentle, where it's smooth, where you're really paying attention to how you transition from each position. So starting with a breath in, you'll tilt your tailbone down and start to draw the lower back away from the floor. And then as you breathe out, tilt the tailbone the opposite way and nice and slowly come into spinal flexion. Hips stay down, your ribs draw towards the pelvis. The lower back is going to squish into the floor. Breathe into the belly to slowly start to expand back into the extension. Tailbone down, arch the lumbar spine away from the floor. And then the exhale rolls the pelvis the opposite way. Ribs draw towards the pelvis. You're back in flexion. Just do this a few more times, really trying to smooth out the movement. So you're not going to extremes, but rather seeing how smoothly you can transition between the two. Notice if the breath or the movement starts to get a little jittery. If it does, perhaps make the movement a little smaller. Good, finish this one that you are on. And then just release back to a neutral spine. Again, just paying attention to how the lower back is feeling. And slide your left leg out on the floor, right leg stays where it is. This time as you breathe in, tilt the tailbone down, arch your lumbar spine away from the floor. Then as you breathe out, return back to neutral with the spine. Breath in, reach through your left leg as you slide your right hip up to the right shoulder, and then slide the right hip back down again. Inhale, draw the knee across towards your long leg, and then exhale, bring it back to the center. Breath in, arch the lumbar spine away from the floor. Breath out, return the spine to neutral. Inhale, extend through your left leg as you draw your right hip up. And then exhale, slide the right hip back down. Draw the knee across to the left leg. The foot stays on the floor. And then open back to the ceiling. One more time. Inhale to arch. Exhale softly back to neutral. Breath in, slide your hip up. And the breath out, slide it back down. Draw the knee across the midline. And then come back to the center. Carefully slide the leg out long and take a little check-in from side to side to notice how the right side hip and lower back are feeling in comparison to the left. You might even slide your hands in that space and just see if maybe one side's sitting a little closer to the floor. And then slide your left leg in and stand it on the floor. As you breathe in, tilt the tailbone down, arch your lumbar spine. As you breathe out, softly return back to neutral. Breath in, reach through your right leg as the left hip shortens up towards the left shoulder. And then slide the hip back down. Knee goes across the midline to your right leg. And then bring it back to the center. 2 more times. Inhale, arch. Exhale gently back to neutral, looking for any of that jittery motion. Inhale, reach through your right leg, draw the left hip up. And then exhale, slide it back down. Inhale, knee goes across the midline. And then exhale back to the center. Last time, inhale. Exhale softly back to neutral. Reach through the right leg, left hip draws up. Slide the hip back down. Left knee across to the long leg. And then knee back to the sky. Slide the leg out long, and again, take a little check-in. Notice how it's changed from when you first lay down. And then grab your block, bend your knees, place your feet on the floor, and slide the block underneath the pelvis. So you can either go for the lower height or slightly higher, depending on what feels best for your anatomy. Once you're in position, draw your right knee all the way to your chest. You might like to hold on to it, and that's just going to pull you into a little bit more of a posterior tilt. And then take your left knee towards your chest, reach it up towards the sky, and then lower it down until you feel either a tug in the front of the hip or you feel like you're going to lose this posterior tilt in the ribs towards the pelvis. So you're getting a nice stretch through the front of the hip flexors, and in particular the psoas muscle. And then just little pulses at that point. We're eccentrically lengthening and strengthening the psoas, which is one of the pillar supports for the lumbar spine, also our deepest hip flexor. And it's also connected to the diaphragm. So sometimes the tension within this muscle affects how we breathe and vice versa. Good. 3, 2, 1. If you can, let the leg come all the way down to the ground. And just a couple of breaths here. Really focus on the belly rising towards the ceiling. And then as you exhale, pulling the belly in. Breath in, let it rise towards the ceiling. And breath out, draw the belly in. So that diaphragm is getting a full excursion, which is also going to help this muscle. Inhale, belly rises. Exhale, belly draws in. Nice. Release your right leg to the floor. Bring your left leg back onto the floor. And just take a little moment, a little check-in from side to side. And then left knee comes in towards the chest. Interlace the fingers around the knee and pull it in nice and tight. Find that posterior tilt. Let's scoop of the tailbone towards your face. And then right knee to the sky, right foot to the sky. Lower the leg down to where you feel a little bit of a tug in the front of the hip. And then maintain that. Pull the left knee in a little tighter. Little pulses with the leg. Pay attention to your breath. See if you can keep the breath moving into the back body as we did at the beginning. A little bit harder when we're resting on the back. Good, and then let the leg come all the way to the ground and focus on breathing into the belly. Let the belly rise. And the exhale, pull the belly in. Inhale, let the belly rise, relax the belly muscles. And then really use the belly muscles, the transverse abs, the obliques to pull the belly in, which forces the diaphragm further up. Breath in. And breath out. Pull the belly in. One more like that. And then carefully release the foot to the floor. Take a little moment in your bridge just to notice. And then raise the hips up, slide the block out. Roll yourself to the side and come up into a tabletop position. And you're going to use your ball and your block. So the block is going to go alongside the leg that's going to stay on the floor. And the ball will go on your back. We're going to do some bird dog, but just a static bird dog. So place the block beside your left leg, and that's going to stop you from leaning out because the block will fall out. And I want you to try and stay away from the block as much as you can. Take your ball, place it on your lower back. And you might even find just this is enough, holding stability here. See if you can gently draw the ribs towards the pelvis. Another way to think of this is breathe into the back body, so that three-dimensional expansion we had earlier. Slide your right leg back on the floor. And then focus on the butt and the inner thigh of that right leg as you lift the leg up without moving your block or losing your ball. And really try to stay away from the block. So if you can feel a little bit of pressure on the block, see if you can pull the hip in a little more. If you can, maybe that left arm reaches. And see if you can keep bringing the awareness into the back body. Breathe into the back rib space. And if you're really working all of those actions, it should be pretty spicy in the leg. I know mine's on fire right now. Good, and then nice and slowly, hand and knee to the ground. Move the block to the other side. Put it right up against the hip. Push into the hands. Breathe into the lower back. And then slide your left leg back on the floor to start with. Again, connect the ribs towards the pelvis and try and pull that right leg away from the block. And then focus on the butt and the inner thigh, lifting your left leg to the sky. And if you can, maybe the right arm reaches forward. So this is a great exercise for bringing awareness to all of those muscles that help to stabilize. So the inner unit, the transverse abs, we've got the pelvic stabilizers through the hips. We've also got the hip extenders. Good, and then lower the hand and the knee down. Now that might be you, you might stay with that. One more little challenge just to really check the stability of this whole central unit. Keeping the ball on your back, push into the hands. Again, breathe into the back rib space. Tuck your toes and try hovering the knees away from the floor. And as you hover the knees, you're trying to keep the ball on the back and the breath in that full circumference of the rib cage. And you can play with maybe picking feet away from the floor, maybe hands away from the floor, trying to keep the ball on. Maybe even opposite arm and leg away from the floor. And then lower down, take the ball off. Slide your right knee forward, your left leg in behind. Wriggle the feet a little wider. And sit your hips back, reach your arms forward, a little hybrid of Gomukhasana and Child's Pose. Just get a nice little stretch into the outer hips. Oftentimes these muscles can be a little bit tight, can be a source of the discomfort that we might feel as well. Good, come all the way up, switch which leg is in front. Move the feet out and sit the hips back again. Notice maybe you've got one side that feels a little tighter than the other, a little more restricted. See if you can still feel the back body expanding with the breath. Good, and then slowly rise up. And just return back to your comfortable seat. You can do this with or without the band around the ribs, but see if you can come back to breathing all sides of the rib cage. So that three-dimensional expansion, slightly longer exhalation. Just noticing the sensations through the body. Perhaps a little bit of ease through the lower back. Or maybe just more awareness of these muscles that help to support and stabilize, as well as move us through space. I hope you enjoyed this. Hope you found it useful. Thanks for practicing with me. Namaste.